Good morning. Thank you for joining us here at the H. Lee Dennison Building. I'm joined by a number of my colleagues, and I thank them for being here. First, of course, is our new Health Commissioner, who, as I've said, has had a nice, easy transition into the position, Dr. Gregson Piggott. Appreciate all of his work and his team in the Department of Health. Great work that they are doing during this crisis. We also have, of course, Deputy Commissioner of the Department of Health Services as well, Dr. Iftikhar. I want to thank her as well. Jen Culp from the Suffolk County Department of Health. And again, the team in the Health Department appreciate all the work that they've been doing with this health crisis. We also have the Director of EMS and Public Health Emergency Preparedness, Nat Bialik, here. Of course, our Chief of Police, Stuart Cameron. I want to thank the Police Department and our Commissioner of the Department of Fire, Rescue, and Emergency Services, John Jordan, as well. Our new Commissioner of the Suffolk County Department of Public Works. We have some new commissioners here, so this is interesting for them to come on board at this time. Joe Brown is coming to us from New York State with extensive experience, so we are very happy to have him on board now. And our Director of Operations, Tom Vaughn, here, and of course our IT Commissioner, Scott Maslon. So again, thank you everyone for being here today. As I'm sure everyone is aware, we've had our first confirmed case of the coronavirus in Suffolk County. The patient, a male in his early 40s, remains in hospital isolation. Suffolk County communicable disease professionals have begun a thorough investigation into the patient's contacts, as it believes the person in this case contacted the virus through community transmission. So far, the department has identified one individual who has been in close contact with this confirmed patient. The individual will remain in mandatory quarantine to help prevent and contain the spread of the virus. We're continuing to work closely with the New York State Department of Health to perform a comprehensive investigation to ensure that anyone who might have been exposed to the virus is isolated. In addition to our first positive case, we're currently monitoring 35 individuals under precautionary quarantine, formerly called voluntary home isolation. There are also 22 students, as you know, who recently returned from abroad in precautionary quarantine at the Stony Brook Southampton campus. They will remain in isolation for 12 more days now, a total of 14 days. I want to emphasize that these students were screened and none of them are symptomatic at this point. So this is an entirely precautionary measure. And that's a very important point with respect to all of this. All of this is prudence and precaution, making sure that we're doing everything we can to contain the virus as much as we can is the prudent thing to do. This is a new virus, so there's some things that we may not know about it. But there is no reason to panic here, to be overly concerned. All of the attention that people see in the news, on the radio, in the media about this is because this is a new virus and because there is a lot of effort going into containing it. That's why there's so much attention on this, and that's very important. It's not because there's a reason for everyone to panic. There is not a reason to panic. Most people who get the coronavirus, will be either asymptomatic or have symptoms that are similar to what you would expect in a cold and a flu. So there's not a reason to panic, but it is the prudent thing to do, it is the responsible thing to do, and it's what government is here to do everything we can to contain the virus. And that's what we're talking about here today, and it's what we've been preparing for. Since the beginning of February, we've been engaged in a multi-agency response coordinating that We remain in close contact with the CDC and the state health department on a daily basis. Receive the latest, most up-to-date information. We've done a full inventory here of personal protective equipment, particularly for our first responders. We're collaborating and sharing information with municipalities across the state who are also dealing with positive cases, and we're focused on public education to reassure residents again that there is no reason for alarm. And starting today, Suffolk Transportation Services will increase the frequency in which they sanitize their bus fleet, additional wipe down of high contact surfaces on buses with alcohol-based wipes. On top of all this, last week we brought together all departments within Suffolk County to conduct a tabletop exercise regarding coronavirus. This training event allowed us to assess and evaluate preparedness, run through possible scenarios, and ensure each department and agency within county government is familiar with the procedures and protocols that are in place. And moving forward, we'll make sure that patients continue to be tested in accordance with CDC and State Department health guidelines. Now, this is very important to understand that testing is still limited at this point. There should not be an expectation that people can go in if they're feeling sick and just get tested. That is not going to happen. That is not what the guidelines call for. And quite frankly, it's not where we are in terms of testing capacity at that point. I know that that is an issue that the governor has addressed. They are ramping up testing as we speak. But as of right now, if a medical professional determines they believe somebody should be tested, they will be in touch with the Department of Health, County Department of Health, who will consult with the State Department of Health. And if testing is necessary and meets the guidelines, that will be done. And then we will follow the protocols from there. So it's very important that people understand, there shouldn't be an expectation that if you are feeling ill, you're just going to go to a doctor's office and get tested. It's not what the guidelines call for. It's not necessary at this point. When that changes and when the capacity is there, that is something we will provide, information we'll provide, and we'll deliver different guidance at that point. We have tremendous partners on the state and federal levels who are working hand in glove with us to make sure that we do have the resources we need to remain prepared, and we're grateful for that as this continues to evolve and we need to react quickly. Those resources and that support is important, and knowing that it is there from the state and federal government, because the counties are on the front lines in dealing with a health crisis like this. And while we continue to do all that we can to avoid expansion, we certainly want people to understand what you should expect is the number of cases to rise. That is just common sense. It is not a cause for alarm. As the testing continues to expand, as testing comes online on a local level, rather than just having to do the testing or ship the testing to the State Department of Health, more people get tested, more cases will be confirmed. Again, that is not a cause for alarm. But it is important for people to just take common sense precautions. So if you're sick, stay home, contact your primary care physician, and you want to work to avoid spreading illness to others. Wash your hands using soap. I was at a press conference with Senator Schumer, who advised singing Happy Birthday. I know the message is getting through because my mother told me the same thing. You have to sing Happy Birthday twice, she told me now. So that's a good thing if people are getting the message. And that's always good advice, by the way. This is just good common sense. Wash your hands throughout the day. That makes sense. Use hand sanitizer if you have it. Alternatively, avoid unnecessarily touching your face. This is a common thing people don't even think about, that we just routinely do as human beings, but it's advisable to limit that as much as you can, and actively wipe down commonly touched surfaces. These are common sense things you can do that can help avoid or limit the spread of the virus. We are, as I said, committed to working to contain the virus. We'll work with all of our partners to provide our doctors, hospitals, first responders with the tools that they need to ensure the health and safety of all of our residents as we prepare for any possible scenario. And when a public health emergency this level happens, we have to do whatever we can to address it, and that's exactly what we're doing. For any residents who have questions about symptoms, travel concerns, tips on preventative measures you or your loved ones can take, there is a tremendous amount of information on the Suffolk County webpage, suffolkcountyny.gov. And for more information, I would encourage you to visit that website. We will be updating that information on a regular basis, suffolkcountyny.gov. For those who don't have access to a reliable internet connection or after visiting the website have any other additional questions, residents may call Suffolk 311, and you'll be connected to a live operator who can direct your call, provide information, direct your call to the appropriate place. For those who are outside the county lines but would like to speak with a 311 operator, you can call 631-853-6311. We'll continue to encourage medical professionals, of course, will be contacting Suffolk County Health Department directly. As of this time, Suffolk County will be restricting all non-essential travel for Suffolk County government officials. We will continue to update you on that as far as any additional restrictions, but as of right now, we are restricting non-essential governmental travel. And as the situation continues to evolve, Suffolk residents should know that all levels of government here are coordinating together and doing everything possible to help contain the spread of the virus. And what we're asking for is continued cooperation with the public, working together. We will get through this. This is something that we will overcome, and we're going to do it in a calm, rational fashion. There is no reason to panic. Everything that needs to be done is happening right now, and as the situation does continue to evolve, we'll provide more information to alert the public as to what they need to know. With that, happy to take any questions.
Steve, could you talk about the one person who has a couple questions? Is he from the Greenport area, and can you tell him occupation? Because I think that's something that some of the reporters don't understand why we're not releasing, especially like if he's an Uber driver, he's a waiter or something like that. And then also the hospitalization part, is he in isolation because he has corona in the hospital, or is he like in critical condition and that's why he's in the hospital? If that question makes sense.
Yeah, no, absolutely. Actually, his condition is improving, so that's very important for people to know. So I think that's a great question. With respect to providing information, the directives from the State Health Department, from the CDC, and this makes sense, are to provide limited information, provide information that we can. But what we don't want to see happen is to people to start to figure out who individuals are, because there can be consequences to that. People can be panicked, certain people can take certain actions, and we don't want to see anything like that. So there's a need to protect the privacy of individuals as well, while reassuring the public that everything is being done with respect to individuals who have been confirmed to isolate and investigate who they have contacted and been in contact with, so that we can advise them as well.
Can you confirm
Yes.
he's at Stony Brook Southampton Hospital?
I believe that has been confirmed out there, yes.
22 students are from Italy, confirming that.
I can't confirm that, but we will check on that.
Okay.
Yeah.
And the
That they were all
Shore
familiar.
River School District said the spouse of a faculty member tested positive for coronavirus. Is that the Suffolk case, or is that person one of the Nassau cases?
That is not related to the Suffolk case.
Okay.
Yeah.
I have a follow-up question
Yeah.
about the patient that's hospitalized. So we were told that he originally went to Eastern Long Island Greenport. Do you know, did he present to the emergency room there? And was there any exposure to staff members at Eastern Long Island Hospital to the virus because of that? Nor are they, like what we've seen in other places, precautionary quarantine, et cetera? Do you know anything about that?
I don't know if he presented there. I don't know exactly what the transfer was, but Suffolk County Health Department has been working closely with all the hospital officials and staff to determine who was in close contact and to, provide any testing that's necessary.
No quarantines or isolation?
Additional people.
As a result of that?
No, just the individuals that we have under precautionary quarantine at this point. Yeah.
But none of them are from the Greenport Hospital?
I can't confirm that right now. Yeah, but we'll provide that.
He's from Greenport?
That's something we remember? No. No, I can't confirm that at this point. And again, I just want to be clear. We're acting under state guidelines which say that you should provide as little personal information as possible about individuals, because what you don't want to happen is for people individually to be able to piece together who individuals are. That's not the right protocol in cases like this, and it's a way to increase concern and panic. So we're going to provide, broadly speaking, details on what's being done, but we don't want to provide really additional personal details. Yeah.
Steve, you said that it was community spread suspected, but he's the first case in Suffolk County. So is there any theories as to how one gets community spread in a community where the virus hasn't been documented?
I would say, given the limited amount of testing that has been done, what we can expect is that there are people who have coronavirus who are unaware, may not even be symptomatic, or if they are symptomatic, may simply believe they have a cold or the flu. So it's likely that it happened like that. As more testing becomes available, and that's why we want people to know, the expectation should be that the number of confirmed cases is going to go up. But that's not a bad thing. That means that the testing is there, we're confirming people, and that each of those cases now is being investigated to determine who their contacts are, so that we can work to spread the virus. Contain the spread of the virus.
And as far as school districts, are you
Yeah.
in touch with any schools, or are you giving any advice to the districts, and you can look forward?
So we're in contact with the superintendents in the different districts. We actually did a presentation, the health department, to the School Superintendents Association. We'll be in touch with them again today. So we're in touch on a regular basis. And this is a fluid situation, so things will continue to move. Guidance will continue to change over time as the situation evolves. So we will continually update school officials, municipal officials as we move forward.
I think part of the frustration, for people is we do hear from public officials to remain calm, this is all under control. But then you have the Shoreham-Wading School District where there's, Wading River School District, there's one employee that may have had a contact and the entire school district is shut down. I think people are frustrated because they're getting mixed messages. Everything's okay, but we're closing units.
Yeah, look, people are nervous, and that's understandable. People are nervous because they're seeing this talked about everywhere. But what people should understand is the reason there's so much focus and attention on this is not because you should panic, but because it makes sense, it's prudent to do everything we can to contain the virus. And that because this is a new virus. We've not seen this before. But there's no indications that there's any greater danger than the flu or what people experience every year on a seasonal basis. But since this is a new virus, it makes sense, it is prudent, it is the right thing to do everything we can to contain its spread. So that's really the difference. People need to understand this is being talked about, this is being focused on so much, not because there's a reason to panic, but because we want to contain and the spread of the virus as much as we can.
Steve, you said one confirmed, 35 being monitored, but how many people in the county have been tested?
Overall, do we have a number on?
We've had 18 tested.
18 have been tested. There are some that we are waiting the results of. I'll get the number on exactly that.
County Executive, just to be clear, there
there are 35 under precautionary quarantine and then 22. The 22 isn't within the 35. The students are separate.
Students are separate, yes. Yep.
And the 18, sorry, the 18 tested are part of the 33 being monitored, or that's in addition to the 33 and the 22?
No, some people have come off of monitoring because, as the 14 days pass.
A
Yep.
follow-up on the first confirmed case in Suffolk County. So when was the employees, profession notified that they were ill and by whom?
When was the employees, you're talking about in the confirmed case?
Yes.
Our communicable disease staff, we work on that. So one of the first things we'll do is when we hear of a case, we're going to interview the case and find out where they work, where they live, and investigate that further.
So
So
when was
as soon as we found out, that was yesterday morning.
So
Yes.
A brewery in Peconic just put out a statement saying that it was one of their employees.
Okay.
Can you confirm that it was?
Well, I haven't seen that statement, but we will take a look at it, yeah, and talk. And again, it's the importance of emphasizing to people they should not panic. Things are under control. The agencies that are in charge of working on these cases are working every day. Every case is being investigated, and that will continue to happen.
Can you explain, I'm sorry, the non-essential travel of government employees, within the county, or what?
Going to conferences, if it is considered non-essential, we're going to limit that travel at that point, just a matter of prudence.
Traveling around doing their
No, not doing their work at this point. Yeah.
Last question.
Can you talk a little bit more about testing capability? You said you've run 18 tests so far. Is that less than need to be done? And when do you think there's going to be more testing available?
So testing capabilities have been based on, obviously that's not us, that's coming from the CDC, and they're working with states and local agencies to build up their testing capacity. That work has been happening now over the last week or so, and local testing capacity is coming online, but it is limited still, so they're working on ramping up as much as possible. So we will continue to provide guidance that we receive from the state health department with respect to the testing protocols. Right now, the important point is testing is limited. The guidelines are very focused on who should be tested, and people shouldn't have an expectation that if they are feeling ill, they're going to go in and get a test for the coronavirus. The medical professional will make a determination, and they'll be in touch with the state health department, with the county health department, and we'll consult with the state health department at this point.
Thanks, guys.
Thank you.